Not all dentists will say this out loud, but Invisalign treatments aren't 100% risk-free. I've worked with countless patients going through Invisalign here in San Antonio, and what I've seen behind the scenes would surprise most people, because most of them believe it's a simple, low-maintenance fix. Pop in some trays and you've got a perfect set of teeth. But that's not the whole truth. So in this video, I'm laying out everything dentists don't tell you about Invisalign, the uncomfortable truths, the hidden risks, and how to protect your time, your money, and yourself. Point number 1, Invisalign is not for everyone. But first, what if I told you some patients go through years of Invisalign, only to end up in braces anyway? Sure, most dental practices will tell you you're a great candidate for the procedure, but they won't tell you what that really means. Because here's a story that happens more often than you think. You decide to get Invisalign to fix your crowding and bite issues. You're excited, you've done the research, and your dentist assures you that the trays will handle everything perfectly. But 2 years go by, you've gone through multiple refinements, worn your aligners faithfully, and spent thousands of dollars. Then your dentist tells you you still might need braces. Now you're looking at traditional braces on top of everything you've already invested. And the worst part is, this isn't even a very rare scenario. It happens because some dental practices will push Invisalign even if it's not the most effective solution, especially for complex bite or alignment issues. And here's the thing, they're not necessarily being dishonest. They might genuinely believe that they can get Invisalign to work. But you have to remember, this is a complicated procedure and a practitioner's belief doesn't always match the reality. And so it boils down to this. Invisalign isn't a one-size-fits-all. It works best for mild to moderate issues, but not always severe ones. Invisalign excels at things like minor spacing issues, slight rotations, and basic alignment problems. But when you're dealing with significant bite issues, significant jaw discrepancy issues, or anything that's more dramatic, traditional braces sometimes offer a better, more predictable result. The problem is that the line between moderate and complex isn't always clear, and different providers have different comfort levels with pushing Invisalign's limits. So how do you avoid falling into this trap? Well, it starts by asking the right questions. What makes me a good candidate for Invisalign? Don't accept vague answers like, your teeth aren't that bad. You want specifics about what movements need to happen and why Invisalign is the best tool for those particular movements. Is my case mild, moderate, or complex? Push for an honest assessment. If they say moderate to complex, that's a yellow flag. Ask some follow-up questions. Would braces get me better results? This is a big one. A confident provider who truly believes Invisalign is your best option won't hesitate to address this directly. Have you turned patients down for Invisalign before, and why? If they've never turned anyone down, that might be a red flag. Every honest provider has cases they've referred elsewhere. But before we continue, if you're considering Invisalign here in San Antonio and want an honest assessment from someone who's seen it all, book a consultation with us. We'll give you the straight truth about whether you're truly a good candidate for Invisalign. No sales pressure, no sugarcoating. Pain and discomfort are a possibility. But let's talk about what no one brings up until it's too late. You see, Invisalign might look harmless. It's just clear plastic after all. But don't let that fool you, because your teeth are going to shift after every week, and that means pain and discomfort, and maybe a lot of it. Some people get jaw pain, headaches, or sharp gum soreness, especially with faster schedules. And here in San Antonio, I've noticed many providers are pushing faster treatment timelines. Faster sounds better, right? Get it done sooner, get your teeth fixed quicker. But faster tooth movement means more pressure, more discomfort, and more stress on your jaw joints and gums. Your teeth are literally being pushed through bone. That process isn't always painless. While Invisalign is oftentimes less painful than braces, that doesn't mean it's completely painless. The discomfort is real, and for some people, it's significant enough to impact their daily life, especially in those first few days of a new tray change. You might find yourself reaching for pain relievers more often than you expected, or struggling to eat normally for days after each change. And so to manage discomfort during and after Invisalign treatment, here's what actually helps. Use chewies, clenchies, or the pull tool, those little plastic things, multiple times a day during the first 2 or 3 days of each tray. These help the aligner seat properly, reduce pressure hotspots, and can even shorten the adjustment period by helping your teeth settle into the new position faster. Stick to soft, cool foods for the first 48 hours after switching trays. Think smoothies, yogurt, mashed potatoes, scrambled eggs. Avoid anything crunchy or chewy that puts extra pressure on sore teeth. Ice cream isn't just comfort food during Invisalign. The cold actually helps numb the discomfort. Take over-the-counter pain relievers like ibuprofen before switching trays, not after. Preempting the inflammation can make a huge difference in comfort. Don't wait until you're already hurting. Ask your provider if longer times between switching trays is right for you, especially if your teeth are more sensitive or you're experiencing ongoing pain. Slower changes equal gentler movement, and sometimes that extra time makes all the difference. Track your symptoms in a Notes app. If the pain is consistent and severe every cycle, that's a red flag. Bring it up at your next check-in. Your provider needs to know if something isn't working right. Point 3. Invisalign can cause recession and bone loss. Let's talk about another thing that rarely makes it into the brochure. Because dental practices will talk about straighter teeth, but they won't mention this. And it's the part that makes me the most uncomfortable at how Invisalign is sometimes marketed. The focus is always on the aesthetic outcome, the straighter, prettier teeth you get at the end. But there's not a lot of discussion about what happens to the supporting structures, your gums, and the bone that holds your teeth in place. Rapid tooth shifting without proper monitoring can stress the gum tissue and bone structure, especially if there's pre-existing gum disease. When teeth move too quickly or when there isn't enough bone support, you can end up with gum recession or bone loss that's permanent. I've seen patients who got beautiful straight teeth but ended up with gums that pulled away from their teeth, creating gaps and sensitivity that wasn't there before the treatment started. And so you have to understand this. Invisalign isn't risk-free, especially if you already have gum issues or you skip cleanings. But let's say you've made up your mind and you're really ready to go. How do you minimize the risks? First, you can start with a full periodontal exam. Before you commit to Invisalign, ask your provider for a full gum and bone health check. This means measuring pocket depths, checking for signs of inflammation, and looking at bone levels through x-rays. If there's already gum recession or even gum disease, it might need to be treated first, before any tooth movement begins. Second, stick to your cleaning schedule. No skipping. Trays trap bacteria against your gums all day, so regular cleanings matter more than ever. Make sure you're booked for professional cleanings at least every 6 months, or more often if you're prone to buildup and inflammation. Third, brush and floss like your gums depend on it, because they actually do. Don't just brush twice a day. If you can, do it every time before you put your trays back in. Use a soft bristle brush and fluoride toothpaste, and floss daily. Consider adding a water flosser or an alcohol-free antibacterial rinse to help reduce plaque buildup under the trays. Point 4. The outcome depends on you. Now, if you're only going to take one thing from this video, let it be this, because everything else depends on it. And yet, it's the part that gets buried beneath all the before and after photos. But first, let me tell you about a patient who came to see me. He was incredibly excited to get Invisalign. He was a great candidate too. He had realistic expectations and was really motivated to get started. But after a few months, his teeth weren't tracking the way they should. The movements were falling behind the predicted timeline. When I asked about his compliance, he admitted he'd been a little inconsistent, taking the trays out for long lunches and skipping a few nights here and there. Now that might not sound like a big deal, but with Invisalign, it is. The trays are designed for tiny, precise movements based on wearing them 20 to 22 hours a day. Missing wear time throws everything off. Suddenly, trays stop fitting properly, progress stalls, and we're looking at extra refinements, more appointments, and more cost. And so everything we've talked about, pain, risks, even whether you're a good candidate, it only matters if you're willing to put in the work and discipline. Because at the end of the day, the biggest factor that determines whether Invisalign works is you. Here's how to develop a consistent routine with Invisalign. Step 1. Anchor tray wear to your daily habits. Put your trays back in after brushing your teeth. Morning, after meals, and before bed. You need like a muscle memory thing. Brush, rinse, trays in, no exceptions. Step 2. Use a timer when you take them out. Every time you remove your trays to eat or drink, set a 60-minute timer on your phone. This keeps you aware of how much time you spent tray-free so you don't go over the 2 to 4 hour daily limit. Step 3. Keep a travel kit with you. Pack a small case with your tray holder, toothbrush, floss, and your biting tools. That way, no matter where you are, work, school, or out to eat, you have what you need to pop them back in as soon as possible. Step 4. Track your wear time the easy way. Use an app to log your wear time, or just mark off your full day wear streak on a calendar. Seeing progress makes it easy to stay motivated, especially during those weeks when the discomfort makes you want to take a break. Look, I'm not trying to scare you away from Invisalign. When it's the right treatment for the right patient who's committed to the process, the results can be incredible. But making an informed decision means understanding both the benefits and the risks. If you're here in San Antonio and considering Invisalign, don't just shop for the cheapest price or the fastest timeline. Find a provider who'll give you the honest truth about whether you're a good candidate, what to realistically expect, and how to protect your investment. And if you want an honest assessment, we're here. No pressure, no sales pitches, just the truth about what Invisalign can and can't do for your specific situation. And if you want to understand why some dentists might push treatments that aren't right for you, watch this next video.